So, hi, everybody, and thank you for joining us today. I'm Harriet Sachs, the volunteer moderator for our APBD patient chats. We've been meeting every month since January of 2014. We share ideas, we share discoveries, we share details of what it's like to have APBD. And we'll open tonight's, or today, because it's not night everywhere, chat with a special learning opportunity. The subject is biosampling and why it's important to us as a rare disease community. Helping us is Dr. Lindsay Gill. Now, Lindsay recently joined the APBD Research Foundation as our research manager. She spent her preceding 10 years as a research scientist with NIOSH, that's the National Institute for Occupational Safety and Health, and she holds a PhD in neuroscience from the West Virginia University School of Medicine. She spent nearly 20 years of her career researching the causes of neurologic diseases and testing potential treatments. Lindsay, I give the floor to you. Thank you for joining us today.
Thank you so much for that introduction, Harriet. It's a pleasure to be here today to talk to you all about biosamples and biosampling. It's certainly an effort that we're interested in pursuing further with the foundation. So before we make any asks of you, I want to make sure that it's clear what a biosample is and why they're important to the community, as well as why the foundation is interested in collecting these biosamples. So let me see, I should be able to share my slides here. Okay, so I will go ahead and skip to the next slide. So what is a biosample? I think you are probably more aware than you may realize about what a biosample is. So it's any type of small sample that could be collected from your body, something like blood or urine or saliva or even a nasal swab. I think we've become all too familiar with nasal swabs after the COVID-19 pandemic, and that was one of the main testing mechanisms for testing for COVID. So, as you are probably familiar with visiting your doctor, that these kinds of samples are routinely collected as part of a testing or a procedure that you may go through for your doctor, especially with blood samples, simple blood testing, um, things like that. And what is of particular interest for us and for the community is that these samples can help researchers better understand health and disease, so that can help them understand APBD better. And so, as this outline down here shows, we can go from, something like a blood sample to some more evaluation in a research lab to then leading to potentially new or better treatments or finding existing treatments that are already out there that might work for the community. So the next question is then, why are these biosamples important? Why do researchers want these samples, or why are they interested in them? So by evaluating things like proteins or other types of markers that might be in these biosamples can help the researcher find new ways to prevent or treat a disease or an illness. You may have heard before someone talk to you about biomarkers. Oftentimes, these samples can be used to identify biomarkers in your blood or in your urine. I know that there's been some studies that the community has been involved in, specifically looking at those types of biomarkers for APBD. And those biomarkers can serve a lot of purposes. They can help identify disease in people that haven't been diagnosed yet. They can be used sometimes to help determine how far progression a disease is. And they can also be used as diagnostic measures. So if you are receiving a treatment, or a researcher or clinician is testing out a new treatment, If they know that that biomarker may change because the treatment is working, that's one of the best ways to help identify if a treatment is going to work for a patient or not. They can also be used in some certain circumstances. They can be used to make uh, medicine and healthcare more personal and effective. And so, a way to think about this is so when you have, genetic testing. So sometimes, depending on your specific variant and your genetic mutation, maybe that makes you eligible for one treatment over another, or can identify a treatment that might not work the greatest for you based off of what's been studied before. But what's important about these samples is that if they're stored correctly, they can last for a long time and be used for a number of different studies and a lot of different work. And so providing a sample now can not only help people now, but also potentially help people in the future. So if you were to donate a biosample, what exactly happens to it at that point? So whenever a biosample is collected for a research study or to put into a biobank, which I'll get into in a second here, they are labeled with a code instead of your name. So anyone that would see that sample or request that sample to try to do any type of testing on it or identify a biomarker, they would only see a code, they wouldn't know your name. And so that level is kept highly secure as well as all of the samples that you may provide to store in a biobank. So I want to touch on the idea of a biobank because that's something that the foundation is really interested in. So a lot of the researchers that we collaborate with and work with and that are part of our research community, they'll collect biosamples as part of their study. They may collect blood or they may collect urine. And usually what ends up happening is when those studies are completed, they hold on to those samples and they will keep them at their location or at their university or their hospital. And sometimes it can be hard to find those samples if you're a researcher that doesn't work there, or if you have a new idea and you don't know yet who to contact to do a research study or find those samples. So one of the things that the foundation is working on, which hopefully you all will hear more about over the next few months, is that the foundation is trying to make a centralized biobank that would hold APBD patient samples so that we could not have these individual locations where maybe there's 5 patients that have participated in a study in California or in New York, or a few patients that have participated in a study in Europe, but their samples are all isolated in those locations. By having a centralized repository or a biobank that the foundation would control, then that way there's a larger group of samples that would be available to anyone that was interested in doing research. And the foundation can help to make sure that those samples that anyone is willing to donate and take their time and the opportunity to give, that they are used for the best purposes. So, as it says on that last little bullet point, there is that only approved researchers can access those biosamples if they're put into a biobank. And specifically, that usually means that someone that would like to look at those samples or take out a small part of one of those samples, they have to submit a request outlining what they want to do with it. And that way, the foundation positioned the way that it is with having more of a expansive knowledge or a wider knowledge of what's going on in the research community, we can decide if that's something that's already been done or if it's something that's worthwhile to use some of these limited samples to do that research. So essentially, anytime you provide a sample, it's a small sample that can make a huge difference to the community by helping to identify ways to better diagnose disease, understand how it's progressing better, and also to evaluate treatments. Because one of the reasons why treatments can fail in clinical trials is if they don't have a good outcome measure. So if there's not an easy way for a clinician or a researcher to understand whether a treatment is being effective or not, then it can make it really hard to determine if that drug is worthwhile to continue in the community. And if it doesn't show a convincing response, then a lot of times those drugs won't pass out of the clinical trial to be a treatment that's available to the patients. And so, hopefully through these efforts, we can avoid that and help to identify something that will help make clinical trials function better, as well as some of those other aspects that can help the APBD community. Um, if we reach out to you about providing biosamples, I want to thank you in advance for considering if you would want to be part of that opportunity. And I hope that this information was clear and gave you answers to some information or taught you something maybe you didn't know before. But if you have any questions, I'm absolutely happy to help them and help you understand that process better and understand what providing something like a biosample may benefit the community and the foundation.
There we go. Lindsay, thank you. Thank you so much. Can we kind of open the floor for just a couple of minutes so people can ask follow-on questions? And and so I have one for you. So the samples that you're talking about would be owned by the Research Foundation. Is that correct?
Yes.
And the Research Foundation, I'm trying to get a grip on this. And the Research Foundation would then review anybody's request to sample the sample. Is that right?
Yes.
Okay. Does
So
anybody,
generally, I'm sorry, generally what happens is so if you were to give a blood sample, they may take one tube of blood from you, but the organization that would be helping us manage the biobank, so basically their involvement is they would keep track of the samples and how many samples may be left if someone were to request those. But they will break those samples up into smaller. So generally, I think they make 10. So if you give one blood sample, that will make 10 smaller samples from that one blood sample. And we would be the only individuals involved that would know the name associated with the code. So for me in particular, right now, I would be the only person that could see that. And yes, so if anyone were to reach out through the biobank to ask for those samples, the request would come to me, and then the foundation, either the board or a few of us would review that request and decide if it was a worthwhile use of samples. So we have the option to say no if it doesn't look like it would be worth giving up one of those samples to do research that wasn't going to be.
is this something that happens once in a person's lifetime typically? If let's say Heidi decides to participate, then she would donate this array of samples one time, or would she be asked to do it multiple times?
So right now we're looking at least to get a one-time donation. I think that with the progression that is associated with APBD, it would be important that as time goes on, if we could get a second set of samples at a different time point from a patient. But right now, since we're kind of building from the ground up, we're looking at at least getting one set of samples because 10, 10 blood samples, for instance, those can go a long way and support a lot of research. So at least at this point, the goal is to at least get some samples in that biobank to kind of have that centralized set of samples that we can help the researchers improve their studies by having more patients be involved without having to try to find all of those patients on their own. But that's not to say that we wouldn't ask for another donation at a later time point if it makes sense for what the research community is looking for, or what the patient community wants to see come out of this work.
Okay, speaking for many of our patients who have difficulty with getting around, getting out of the house through the neighborhood. Is the foundation aware of that difficulty and looking to do something to make it easy for us to help ourselves? Do you know?
Yeah. Yes, absolutely. So that's something that is always in the back of our mind. And so the organization we're working with, it's called Combined Brain. One aspect of their program is that they can send a mobile phlebotomist directly to your house. So if you're not able to leave home or you need a lot of assistive devices to get around, they can come to you and collect the samples in the comfort of your home. And the Combined Brain will also ship all of those supplies directly to your door, and that phlebotomist will take the samples with them and mail them for you. So, other than being present at your house at the designated time, and being willing and available to provide those samples, we're trying to make it work the best for the community with as few issues as possible or challenges to overcome.
We have people who are in the United States, but we also have people in Canada, in Europe, and I don't know that we have any Asians at the moment in our group. Will this start with the Americans first? Is that the idea? And tell me what the thought is.
So right now, Combined Brain is set up to mostly work with the United States. So we're going to be kind of, at least for a larger set of samples like blood and urine, that's probably going to be specific to the United States for right now. One of the projects that we're looking into that would be related to drug repurposing, so finding existing drugs that may work for the APBD community. That requires the nasal swabs, and that company is able to ship the nasal swabs across the entire globe. So, with that project, we're hoping to reach out to the global community for APBD. It will look a little bit different for a US participant versus a non-US participant as far as who's sending that package to you. But at least right now, that is the step that we're looking at to get our whole community involved in. But having the phlebotomist come to your house, that's mostly just been coordinated in the United States for right now. But I think there are efforts to try to expand that into other countries other than the United States.
So this isn't starting right now this week, I assume, but what is the goal for the first number of volunteer participants? Do we have a number that we're trying to hit?
So right now we're working to get five patient volunteers that can kind of go through this process with us and help us identify where there might be some challenges specific to our community that we need to address either ourselves or to work with Combined Brain to find solutions for. Um, after that, and once we want to make the process easy for everyone that chooses to be involved. After that, we would be looking to add at least another 15 to 20 onto that, hopefully by the end of this year or early into 2026.
Well, that's pretty quick turnaround. That would be we have to mobilize ourselves to provide those 20-ish people pretty quick. Okay, thank you. Thank you. Now that I've hogged the floor, but does anybody else have any questions that they would like to pose to Lindsay? This is terrific.
Harriet,
This is
Harriet, I raised my hand before.
Go for it.
Hi, Dr. Gill, wonderful presentation. Question, do you have access to, or could we make available to you the genetic samples or results that we had done through the University of Pennsylvania Medical School?
Yes. So as part of the full biosampling process through Combined Brain, they'll collect when they do consenting, because just like any clinical study, you have to fill out consent forms so that they know you're willing to participate and have agreed to all of those terms. As part of that process, they will ask about whether or not you've had genetic testing and if you know your variant. So there's some survey questions that will ask that, but I think those are general, just to have you been tested and do you know your variant? But I believe in their consenting forms, they have an option to actually include the specific variant.
Great, thank you.
Dr. Gill, who do we contact if we're interested in participating, either the initial group or the subsequent patient group?
Sure. Anyone can contact me. I had my email on the slide, but I can drop my email in the chat so that if anyone wants to reach out to me or has questions about this that they'd like to email or talk about offline, I'm happy to do that. We are going to be reaching out to those 5 patients soon to volunteer. And then hopefully that as long as that process goes off smoothly, we would be reaching out to the rest of the community to look for those additional volunteers. Some of it is, there is a cost to collecting these samples. So, we need to be mindful of that as we go forward. So we're probably going to be looking at batches or phases of acquiring these samples from the community or requesting the samples. But we're hopeful that, we're really hopeful that we can get to at least 20 patients beforehand. And if anyone also, if you have a family member that lives close or, a mother, child, sister, brother, we're also interested in collecting control samples as well as the patient samples. So if anyone wanted to discuss that further, they could reach out to me as well. And like I said, I'll put my email in the chat right now.
And while you're doing that, I'll say that if for any reason anybody has any difficulty capturing the information in the chat, you know how to reach me, and I can get you in touch with Lindsay, within 5 minutes. So don't hurry, don't step back from contacting her. And the other thing, you did mention cost, Lindsay. Is that cost borne by the patient or by the research foundation?
No, it will be borne by the foundation. So we're looking at, working with the community to collect the samples, and that at least at this time, that's been the discussion, is to have the foundation work through those costs.